Hello, everybody, and welcome to Get Your Life, the show that helps you see your life as a gift. You were born for a reason, and guess what? The world needs you and what you have to offer. I'm your host, Dr. Carolyn Edwards, and I have an amazing guest today, Dr. Kaliyah Brown-Gaiter. She is going to help us keep our physical bodies together, as well as help us understand how motion can be medicine. Let us welcome Dr. Kaliyah Brown-Gaiter. Welcome.
Thank you so much for having me.
Thank you for doing this. This is her first time. I'm just going to tell a little bit. This is her first time ever being interviewed for the podcast. So I feel honored and blessed. Yes. And I know she has a lot of great information for us. She is a doctor of physical therapy. Yes. And when most people think about physical therapy, I think about you broke something. You're trying to repair something. I fell and sprained my ankle twice. So I know all about physical therapy. So can you tell me how physical therapy can actually help us live a better life?
Yes, of course. So I think a lot of times with physical therapy, everyone thinks about what you said. And in a lot of other states, physical therapy is moving into that primary care role where you see us in the beginning before you need to go to an orthopedic or a neuro or something like that, because we're movement experts. That's what they call us. So we're able to look at the whole body to see where you have dysfunctions and where your ailments are. And we can create a specialized plan to help you use your own body to heal itself. So rather than letting it get to the point where you finally had to get to the surgery or something like that, we can help you right from the beginning because we're able to spot that dysfunction that you have, create a specialized plan for you, and go ahead and help you from prevent you from getting that surgery from the beginning.
I love that. And what I found out is like what you said, you may see some issues we don't see. Mm-hmm. For example, a friend of mine was saying they had some back issues that led to foot issues. They had plantar fasciitis and some other stuff, but they thought it began in the foot, but it began in the back. So can you tell me how often do we we love Google. We are Google doctors. Yes. So how often do we misdiagnose ourselves and our issues?
That happens all the time. So what we spend a lot of time doing is educating our patients on how the body functions as a whole. So just as you said, she thought it was in the foot, but really it was the back. So if you have an issue with your back, that's going to alter how you're walking on your hip. Yep. That's going to alter how you're walking on your knee and ultimately affect how you're walking on your feet. So it's all connected. And so many times we think, you hear things thrown around. Everybody has sciatica. I have sciatica.
Yeah.
You don't have sciatica. You don't have sciatica. And that's what they call it, sciatica. Yes. You don't have that. So, we just see something that sounds like what I have. Yeah. You know what? That's what I have.
Right.
Come see a physical therapist. Allow us to really do some tests on you to assess your body as a whole. And therefore, you don't have to go around claiming some condition that you probably don't really have.
Exactly. So before we go to ortho, okay, so let's say in my situation where I fell at once and then I fell off my bike the second time and I sprained my ankle. I hopped around for quite a while. So before I go see the specialist, I should come see you.
Yeah. So, it's a little different depending on what state we are, but we have something called direct access. So you're able to come see a physical therapist 30 days without basically a script or a referral, depending on your insurance. So to me, you can't go wrong with seeing a physical therapist first because it's going to just save you a lot of time from getting to an ortho, which may take, 3 weeks to get an appointment.
Yes.
Then you have to wait another couple. You know what I mean? It's just a lot of hoops you have to jump through when you can just come to us, and we're specialized in those type of injuries. So yes, the ortho still has its place, when you have those bigger injuries where you may need a little bit more than exercise or the things that we can help you with. However, a physical therapist honestly can be your first stop for almost any musculoskeletal condition. We treat them all literally from the mouth all the way to the toes.
Who knew that? I did not know that.
Yeah.
So you're saying if something happens and we are not feeling like we should, so we can come to you without having to go to a primary care, or do we still go to primary? Some people have to get that referral? Do we have to do that?
A lot of times it's insurance dependent. And then if you're somebody who doesn't have, you can come straight to us. You have 30 days. And after those 30 days and you know, we feel that you need more, then at that point you do have to have a referral.
Okay.
But a lot of times those issues are resolved before then. So it saves you a lot of hoops when you just come to us to start with.
I agree. I've found people that have hip issues, that thought they had foot issues, or thought they had leg issues. So I agree. I agree with what you said. So I also wanted to ask you, when we have these pains and we're claiming all this stuff, I'm hearing now the medical community talk about how our spiritual mindset, what we believe. Do you see that that our belief about how we feel or what we think is going on, do you believe that affects it negatively or positively?
That's my bread and butter, 100%. So many times I've seen a patient come in, say, I never like to downplay anyone's injury, but say for the smallest, what I would call a small condition, but they have, you know, made it such a big thing in their head that every little thing bothers them. Then you have on the other hand, someone who has had the most intense surgery that you could think of, but they have already claimed healing. They have already claimed that I'm going to get through this, that I can do the things that my body is capable of doing. And you're going to see a big difference in the one who says that I can do this, the one who believes that they can heal, versus the one who just focuses on the pain, who focuses on this is never going to get better. So what you put your mind to with therapy is definitely going to affect your outcome. And that's something I try and tell my patients all the time. You have to believe that you're going to come out on the other side of this. I can give you all the exercises. I can do all the massage. I can do all of the different joint mobilizations on you. But if you yourself don't believe it, it's not going to happen. It's not going to happen.
I agree with that, because even for myself in that situation, and I went to therapy, I was like, oh no, I'm going to play pickleball again. I have to get this healed. I have to get up and I have to get moving. So as you are telling the patients to believe they are going to heal, how important is it to do what you teach at home? Because sometimes I know you would tell us something in physical therapy and we only do it when we come and see you. Yes. So how important is it to also continue the therapy at home?
It is very, very, very important. I tell my patients all the time, you only come to me 2, maybe 3 times a week.
Right.
So what you do on those other days is what's going to make all the difference, especially if this is something that you have been dealing with for a couple years or a couple months.
Right.
The 2 days that you come to me that's not going to do much. Prime example, I have a patient who only comes to me once a week, but I've given him all the exercises. He is very consistent and dedicated. When I did his reevaluation last time, I mean, it was a tremendous difference. Wow. Mind you, he only sees me once a week. So he's doing everything on his own to get the results that he needs. So homework is very, very important.
I like that homework. I like doing my homework.
Good.
So I sent you a question, and this is a question that's dear to my heart. I feel like sometimes we take our bodies for granted, and that we do things to our bodies, not realizing that over time, the wear and tear, over time, not really caring for ourselves adds up. So when you think about the body, do you help your patients understand that we also have to be good stewards over the bodies we've been blessed with?
Yes. Like I say all the time, you only have one body. You've only been given one. And I always look at everything that I have that it's not mine to begin with. You know, I always say everything I have is a gift from God, including my body. Right. So I treat that as a gift, and I try and get them to understand that you even being able to walk in here today, or even if you came in on a wheelchair, that's a gift in itself. So you have to take care of what you are able to do, or the function that you do have. Okay, let's optimize that. If you do have the ability to move your leg up and down while you're in that chair, okay, well, at least let's do that. You know what I mean? So you have to take care of what you have, because you may blink and you may not have that ability anymore. And then you're going to be, oh, I wish I would have. But at that point, it's too late. So, you know, we get to a point, I get patients where they may be too far gone in their opinion, but I'm like, we're not going to harp on the past. Right. Let's look at the right now. And I need you to see that your body is still a gift. So let's focus on the right now and go from there.
Amen. I like that. So let's think about the average person at home. What can we do? We need to get our bodies moving. As they say, the body in motion stays in motion. Yes. So let's keep being in motion. What kind of things could we do if we had a sedentary, we sitting on the couch, we looking at TV? Is there some stuff we can do as we sit on the couch and look at TV?
Yes. So one thing that I actually got this from my dad, he always would say, you know, when the commercial comes on or if you're watching a Netflix show or something like that, okay, when that episode goes off, you're going to go ahead and let me get 10 push-ups on your knees, you know, let me get sit to stance is what we call it in physical therapy, 10 squats. Okay. You know, let me see you do some 10 jumping jacks or whatever it is that you are able to do. Just give yourself structured movement that you can do every episode or every commercial or every time the commercial comes on. Okay, I'm going to walk around the house 5 times, little things like that. But when you're doing it consistently, you do see a payoff. It's not something that you can only do, you know, once.
You know how we
you got to do it often.
Yes, the new year comes and we're going to get in shape. We're going to start moving. And then by the 10th, we're finished.
It's over with.
Okay. So I agree that we cannot just do it that one time. I like that because I saw something and it was like in between the show, you can put your arms out or you can lean to the side. And I think about some of the people that don't have as much mobility. Yes. Like you said, it's something. So think about, we not going to do the push-up. I'm just being honest. The average person is not getting up at the commercial doing jumping jacks. No. So let's say we are sitting. So tell me, what can we do as we sit?
Simple exercises. Okay, you're stretching to the side, things like that. When you want to just try and get the muscles going. So I always have people put their arms out, you know, reaching up, reaching down, reaching to the floor. If you're sitting, kick your leg out, kick it back down, things like that. Seated, going up on the toes, coming back, lift the toe. You know, different things like that. You do it. You could do those a bunch of times because it's very low weight. There's not a lot of pressure. So you do that over and over and over. Next thing you know, you're going to find, this don't hurt as much when I do it. I'm able to get to number 30 now. Before I had to stop at 10. You know what I mean? So those are little things that you could do. And chair yoga is a big one too. So I tell a lot of my older patients, look up little things on YouTube, chair yoga, chair exercises. There's a whole lot you can do if you are limited or confined to a chair or a small space.
Okay, that's very good because I'm just being real. A lot of people are not getting up, running around the house, doing jumping jacks and stuff like that, especially if they aren't physically fit.
Yes.
So yeah, that's starting with the chair. We can start there.
Work with that.
I know, yes, we can lift up the toes. We can do some pushes and things like that. Right. Yes. So my next question is, so we talked about the mental and the physical. We talked about the sedentary life. What about people that are active? Like now we are big into pickleball. Yes. Everybody wants to play. However, the first time a friend of mine did a clinic, he pulled his Achilles. So how important is stretching? Or you tell me, don't let me guide you. You tell me, Dr. Physical Therapist, what should we do before we get out and exercise? Do you have a routine that we should do so that we don't injure ourselves?
Yes, that's one of the biggest mistakes and the biggest things. People go out and play cold with their body cold. You have to warm up your body. So, going the length of the court, kicking the legs up, go ahead and swing the arms, doing arm circles, bringing the hips into circles as you're walking, things like that. If you have a band on, go ahead and walk with the band to activate the hips. Different things like that to prime the body for the movement that you're going to do, especially if it's not something that you've been doing. Like if this is just something you picked up yesterday. Right. You definitely just can't go out there. You have to warm up your body because your body's not used to being challenged in that way. And that's just an injury waiting to happen. Right. And that's usually when we see people they picked up pickleball
and they just
started doing it.
Yeah, like I heard somebody said the other day, I never stretch. Yeah. I'm like, that's not good.
You have to stretch. After is better than before. So a lot of times this is a big misconception. People like to stretch cold muscles. You don't want to stretch cold muscles.
Okay, what is a cold muscle?
So if I just got out of the car and I got to the pickleball court, I don't want to start doing these static stretches like that. No, I want to make it a moving stretch. After I play pickleball, then I will do a static stretch. So you want to do something called more like a dynamic warm-up, which is the things that I had just explained, where you're moving. Yeah, you're moving the shoulders. You're kicking the leg up and down, not just like statically stretching your hamstring. No, you're moving it in and out of its range. Okay. And at the end, then you just hold it in that lengthened position.
Okay, so put it in the range that we're going to move. So if we're going to stretch, we're going to bend, we're going to run. So do something like that.
Correct.
Okay, so we've been doing it wrong the whole time because we get on a court
and start holding it.
That's what we do. And we bend down and we might stretch out the paddle. So that is good stuff. So I'm learning something that I can take back to them. Okay, so no more static movement before the exercise.
Correct.
And then at the end, we can do the static movement.
You do the static.
Now, does that also apply if you're going to work out at the gym or something like that?
Yeah, same thing. Wow. Same thing. So a lot of times you see people where you can kind of get away with it, maybe if you did like the bike or the treadmill and beforehand, and then you do a little bit. But even then, it's just best to do everything moving. So rather than just holding that stretch, go in it, come out of it, go in it, come out of it, and gradually warm up the muscle that way. At the end, once you've worked those hamstrings, you've worked those quads, then go into that lengthened position and then hold it.
Okay, so go into it. Come on, girl. I need to write all this stuff down. So when I go to the gym, go into it, come out, or ride the bike or something. So if I'm riding the bike and then that's helping me get my hamstring and my quads going. So should I be doing something with my arms?
You can, especially if you're going to be doing arm workouts that day. While you're riding the bike, you can be going in and out, going over the head, things like that. So it's ways you can incorporate it at the same time for sure.
Okay, well, awesome. So the show is all about Get Your Life. Yes. So tell me what made you what was it about you and your mind or something you loved about the body? Like, what made you pursue physical therapy?
That's a couple-fold question.
Well, take your time.
So it actually started for me when I was in high school. I was an athletic trainer. So that's when I was first introduced to like a lot of just helping people get back to what they wanted to do. So from there, I thought I wanted to become an orthopedic surgeon because I was like, I want to do something else,
Right.
But it just wasn't what I thought it was. It wasn't until that I was introduced to Felicia Freeman, and I got a chance to shadow her. She's a physical therapist, that I finally saw a job that combined everything that I loved, movement, being able to have conversation with my patients, seeing them 2 to 3 times a week. I love people. I like to talk to people and I like to make them feel good. So when I saw an opportunity to make that a career, a job where I can help people feel empowered that you can do what you are putting your mind to, you can help yourself get better. And while pouring into them while they're also pouring into me, because people will often think, it's the doctor or whoever is the one that's pouring. No, my patients bless me plenty of times with the wisdom and knowledge that they share me. So this field has just really been more than I can imagine. I've only been doing it for 1 year, but I'm so excited to see what the rest will be.
Well, just keep living. It's going to be exciting. The reason why I always ask people that is because sometimes people think it's one path. Like when you get out of high school and people say, what do you want to be when you go to college? And a lot of times you don't know. But I like what you said, because you say you like talking to people. That's a clue. You like empowering people. That's a clue. You knew you didn't probably want to go the medical route where you were doing surgery, because that's med school. That's something different. So it's like you can pivot, and then here you are. And so as I talk to the guests, I just want everybody to know your life is your life. And that's why you have to get your life. Don't try to get somebody else's life, because your path may not be path.
That's right.
So I just want people to know to look inside themselves and find out what is it that brings you joy. Mm-hmm. So I too was like you in terms of my career. Like I always say I'm on my third career, but it always dealt with talking to people, empowering people, helping people. So if you had what is the number one advice that you give patients? Like if you had a little list, to-do list, and someone came to see you, what kind of advice do you give them after they leave? And then after that, explain what is an appointment like when people come, because sometimes people are afraid to come
to a physical. Yeah.
And you can switch the questions around if you want to.
One of the main things that I try and leave people with when they're for their first appointment, I want them to understand what I just explained to them. So I'll ask them any questions. And then what I leave them with is, little by little, we will start to make a change. I don't want them to feel that all at once it's going to happen. No, I tell them I want you to start where you can make a change. So if that's for you in the morning, we're going to incorporate a couple of these stretches, or in the evening, we're going to incorporate a couple of these stretches. And that's just where we're going to start with. I give them 2, maybe 3 at most exercises to incorporate, and I just let them know that this is how we're going to do it, little by little. Don't worry if you miss a day, it's okay, you're human. I just try and just put it in perspective for them and just let them know to make it realistic,
right?
So that they can stick to it, and then we go from there. Because if you give them too much, it just becomes overwhelming.
It does. It does. So at least you know that, because a lot of times if you give me too much homework, or you give someone too much homework, it becomes frustrating. And to be honest, we are hard on ourselves. Yes. We like, well, Dr. Kaliyah told me to do this and I didn't get it right, so forget it. Yes. I'm not going to do it. Yes. And I'm sure when they come back, they didn't do it. You can tell.
I know. They didn't do it. I know they didn't do it. And then to your other question, so if it's your first appointment, you come in, you're going to fill out some paperwork. Everywhere you got to fill out paperwork. And when you sit with me, I'm going to ask you some questions. Basically, what brings you in today? What has been causing your pain? So it's going to be a conversation in the beginning of you explaining and me listening. I think so many times people are going to health professionals where they are not being listened to. So at least I can assure you, when you come in my chair, my place, I'm going to listen. You know what I mean? And from there, I'm going to assess your body. So if it's your shoulder, I'm going to look at your shoulder as well as the joints above and below, the whole body, just to see where you may have some dysfunction going on. I'm going to check your strength, your range of motion, all these different things that we're taught in school. From there, I'm going to explain to you basically what I found. I found that you were weak in this area. This may have been causing your pain because of this in the third. From there, we're going to go into some exercise. So they're going to get treatment if they're on time.
Okay.
We're getting treatment. We're getting treatment.
Get all this. Okay.
Yeah, then you're going to go into some treatment, usually the ones that I'm going to send you home with. And then from there, we're going to go over again everything that I just explained to you to make sure you understand what it is that I just talked about. Because some people never had anything explained to them. They just say, this is what the doctor told me, but they didn't tell me what that means. Right. So we spend a lot of time in that first appointment just educating on what this means, what a condition like this can cause, and how you can prevent it from getting worse. And from there, we just look forward to the next session.
So does a person come with x-ray? Normally, do they already come with the x-rays, or you kind of give them the assessment and then they go to find out what it is after you said?
Yeah, it all depends. So you have some people who are coming way after the fact. So they've been to their primary, who then sent them to the ortho. The ortho sent them to get an x-ray. And from there, then they're being referred to physical therapy. So they may come to me already with imaging showing this, that, and the third. Or I can just have someone who may have just went to their primary care physician for, say, shoulder pain. The primary care physician sent them to me. I'm assessing them that day to see what's going on. But I think one of the biggest misconceptions is everyone feels that they need imaging, an x-ray, or an MRI. Yeah. You don't need that. You don't necessarily need that. A lot of times we get patients before they have any of that. And we're taught in school, what these conditions look like. You know what I mean? So when I'm assessing and it's coming back as this, or I'm testing this and this is what's happening, I already have an idea of what's going on. Now, if it's for your peace of mind, you want to go pay that money and have it, okay, go ahead. But it's not necessary. And that's one thing we spend a lot of time trying to teach our patients. Just give this a chance first.
Yes, I like that.
Yes, give this a chance first. Now, after the fact, if you still feel that, you want the MRI and you need to know, then go ahead. But I don't make that a requirement for the beginning, or I don't recommend that right away, unless now it's something that's like life-threatening, where that's another situation. Right. Someone comes in after a car accident and I think they have, a loose ligament in their neck or something like that. That's different. But other than that, you don't have to have imaging.
You have to talk us down off the ledge.
Yes.
Because Dr. Google will
make you.
Yes, that we have this or we have that. And then sometimes we looking at you with the side eye. She did not send me to get a CT scan and things like that. So I guess as we prepare, because let's just face it, like you said, some doctors, they don't listen. And that white coat syndrome is real.
Very real.
So before you go to the doctor, some people they have anxiety, they are nervous. So give us some tips on, before we come to see you, how can we come in the best state of mind, and how can we prepare? What should we bring and things like that?
Well, I always say coming to physical therapy is always going to be different than any other specialty or profession.
Okay.
I don't know what it is about us, but we're just different.
Is that good different?
A good different.
Okay,
a good different. So come with the expectation, like, this may finally be the opportunity where someone is going to hear what's going on with me and really listen to this pain that I've been having for so long, and not just try and shove medicine or pills or injections. So come to physical therapy always with an open mind.
Okay.
That's the first step. A lot of times, too, people look up of what they think physical therapy is, and they think we're going to massage them for 30 minutes. We are not massage therapists.
Like, you going to crack my neck or something.
Yes, we are not massage therapists.
Okay.
We do soft tissue and certain things, manual techniques is what we call it, with our hands as we see necessary.
Okay.
However,
But
don't
you may
expect.
not get,
Yeah, you're not going to get 30-minute massage.
Okay.
No. So that's another thing we have to educate a lot on, because also, too, there's a time and place for that. It will relieve, tension that you have, but you have to follow that up with exercise. That's how your body gets stronger. That's how it's able to maintain its alignment through you strengthening those muscles. So until you do that, the massage will make you feel good, but it's going to go right back, because you didn't train those muscles to maintain that new position that you just got it in. So we try and just really tell them, this is going to be a lot of exercises, but it's all at your own pace, Okay. So come into it knowing someone's finally going to hear me. Not getting 30-minute massage. They're going to teach me how to do things on my own. That's the main thing. We want people to leave feeling independent and empowered, knowing if something comes or happens again, okay, I remember last time she said this happened, let me go ahead and do this. And they may not have to come in next time, because they remembered the things we went over. So it's really about teaching people how to just take care of their bodies and how to use movement as medicine, because that's essentially what it is. You have to move your body. If you don't, everything else will just start to fall apart.
I agree. I always, like I say, you hear, I don't know who came up, we say they. I don't know who came up with this, but the body in motion stays in motion. And as I get older, I recognize that later in my career, I sat at the computer a lot, and I did not kick my legs, and I did not, and I started feeling little aches behind my legs and things like that. When you come to the physical therapist, should we come in like workout stuff, like comfortable clothes? We shouldn't come. Sometimes we are so afraid we just put on anything.
Yeah. We come dressed like this.
Come dressed up. So should we come in like something very comfortable where we can, in case you have to move our legs and kick and stuff like that? Because the normal doctors, some people dress up sometimes. They don't want you to think that you don't have it manners, so they dress up. So how should we dress to come see you?
Yes, for sure, come to us comfortably.
Okay.
And then if it's something where the issue may be in your back or in your knee or something like that, don't put on any restrictive clothing where I can't access your knee because I need to be able to touch. I want to be able to see. I want to know what's going on. And if I do need to do soft tissue or something like that, I can access the area that I need. So you can't go wrong with the gym attire or comfortable clothing for physical therapy because you are going to be exercising.
And that you made a good point. So even if I do come in exercise clothes, like you said, don't put on something so restrictive that you can't pull my pants up because then it's like, I have to take my pants.
That's what I get patients all the time. I say, you here for your knee? And they got on these tights all the way down
all
here.
the way down. It's like it doesn't roll up, or you have on like compression tops or something, and you have to get the shoulder. So I've learned so much. I'm laughing at myself because I've done all the stuff that I say people shouldn't do. So I'm learning. Is it anything that I did not ask that you want us to know that we should be doing? Whether in terms of exercise, do you think we should walk every day? Should we find something we like? Mm-hmm. How can we use movement as medicine? I always tell people, find something you love to do. Mm-hmm. Because if you don't like to do it, you're not going to do it. So you give your tips.
Yes. The low-hanging fruit that I always give people is walking. If you can get walking, whether that's on your lunch break or, in the morning before you go to work, whatever the time of day is work best, you can't go wrong with walking. And a brisk walk is even better. So you should be able to hold the conversation, but I can't sing. So you should be able, that's the difference. That's how you know you're walking at a brisk pace. I can talk, but I cannot sing. If you can get that in, that really helps a lot with the cardiovascular health, loading the joints, getting the oxygen flowing. Those are some of the important things you want when you're exercising. And then secondly, like you said, find something you like to do. So if you like to dance, if you like Zumba, I don't know, if you like skating, swimming, find whatever it is that you will do consistently.
Right.
So whatever you can find to make you get up in the morning or make you, when you get off work, to move your body, do that one thing. And even if it's only 20 minutes, it does not have to be an hour. I think that's where a lot of people mess up.
Yes.
Everyone feels that if it's not an hour or hour and a half, then I just can't do it. It could be 10 minutes every single day. It will add up and it will make a difference versus you doing one hour workout
for the
whole month. You know what I mean? So if 10 minutes is all you have, make use of your 10 minutes. So if your kid is outside playing, go play it outside with them. If they're at practice, take a walk around the park while, they're warming up, and then you can go ahead and watch your kid. There's different things that we just have to try and be more mindful of. Right. Another one, my dad, I keep saying my dad because we had a gym, Gia Fitness. We were in the community. So we will always tell our clients, park a little further.
Yes.
Park a little further. Take that extra walk to the grocery store.
I love it.
So it's those type of things when you make up in your mind, I am going to be a person that moves my body. I am going to be a person who, believes in movement and embody that. You find those little ways in your day to just make that happen. It doesn't have to be some grand thing that everyone tries to make it seem. You don't have to be in the gym. You can do everything you need with no equipment.
Just that one alone may get 100 people because we listen to all these things. Like I remember one of the myths or one of the things that I remember for myself is that you have to work out consistently like a half an hour. And then I heard somebody say you can do 10 minutes in the morning, 10 minutes at lunch, and 10. So is that adds up kind of like what you said? Is that something we can do too?
That is definitely something you can do. It doesn't have to be. Yes, ideally now, if you can do your 30 minutes, okay, that's better. But if what you can afford to do is 10 throughout the day, do your 10 throughout the day. It does add up. Those little, tips and tricks that I talked about. Parking a little further on your lunch break. Okay, you know what? This time I'm going to only eat for this portion and I'm going to take a walk for the rest of it. That's something because everybody says, I don't have time. Okay, well, where do you have time? You're going to have to give up something. Right. You have to sacrifice something.
Something to make it work.
Yes.
Well, as I said, that little half an hour was going to run quickly. It is over. So tell our audience how they can find you.
Yes, you can follow me on Instagram at Kaliyah, KALILLIE_ on Instagram, and also follow Gia Fitness on Instagram, where I'm going to start giving more health tips, physical therapy tips on there as well. And that's GIAH Fitness on Instagram.
All right. Well, thank you for tuning in. Thank you, Dr. Kaliyah. This has been awesome. Remember, we are live on community newspapers as well as the YouTube. And then I replay the show Fridays, 9 a.m. on my YouTube channel at Dr. Carolyn Edwards. And you can find me everywhere, Dr. Carolyn Edwards. So thank you for tuning in. And remember to get your life, because you really are a gift. And we need you. Until next time.
I know it gets hard to find the light sometimes. It feels easier to hold on to what's been keeping you down. You were made to fly, so now release, let it go. You were made to soar, so just breathe. Feel your power. Learn to dance in the rain or the shine. Every step you take is the